Okay, I'm ready.
Yes? Both are ready?
Yes.
All right. So if you have read and understood, considering it communication skill station, please begin.
Hi, Miss Sarah. I am Dr. Ahmed Awad, one of the surgical doctor. I am really sorry. We are really sorry letting you waiting, Mr. Mann, for a long time. But unfortunately,
yes,
Dr. Mann
I have been waiting for a long time, doctor, and I don't know anything about my husband. How he's now.
Oh, I am sorry letting you waiting for a long time. But Mr. Mann was called for an emergency case. Let me explain to you what. Let me explain you what. Okay.
Where is Mr.
Your Mr. Mann was called for an emergency case, and I will make a new appointment with him to meet him in another meeting. Okay.
Okay. So what are you going to tell now?
Okay. Your husband was came a couple of days to our emergency with tummy swelling, and there we took some tummy fluid, and the sample was cancerous cell in his tummy. For that, we order a CT scan, and we order a CT scan to know from where the cells come from, and we need to know what's the type of the cell. But unfortunately, the CT machine is not fixed, and it needs time to be fixed for maybe 1 week.
Oh, doctor, but this is too long, doctor. I need to know more about my husband. And you told me that the only investigation needed right now is not available.
Yes, but we can do an alternative plan, like ultrasound scan, which is a scan for the pregnant woman. And the other alternative is to do an MRI. But in this situation, we have to inform Mr. Mann about this investigation and to take his opinion. The last alternative plan is to transfer him to do the CT scan to another hospital.
But
Yes.
doctor, I'm worried. Do you mean that all this needed because my husband may have cancer?
I am really sure I know this is a tough situation, but the only thing that we have in our hand is the tumor fluid, which show a cancerous cell. But to answer like this question, we have to know what's the type of the cells and where it comes from, and what's the treatment option we have for this cancers. And so for that, we order a CT scan.
So, doctor, how will be treating my husband, doctor?
Sorry?
How would you be treating my husband?
How to treat? Oh, okay, I know. I feel with your apprehension. To answer this question, we have to know, as I said to you, where this cell come from and what type of this cell, and to involve the other team to know what's the best treatment for him.
And if you find this cancer,
The sound is very low. I cannot hear you.
if this is really cancer, doctor, and if It may be advanced, doctor. What could you do?
I can't understand the question.
If you found
Would you
that
do the
he has a
surgery?
cancer,
Yes. If
Yeah.
it is the cancer, won't you be doing the
I
surgery?
understand. I understand your question. Yes, we do surgery for cancerous patients, but in your husband's condition, as the cancerous in the tummy and in the fluid of the tummy, this gives us an impression that it's an advanced cancer. And in advanced cancer, we don't do a big surgery with a little benefit. And we cannot let the patient suffering from pain and pain with just a little benefit from the surgery.
so you will let him be without any treatment.
Sorry, what?
You let
So
him
you-
be without any treatment. This is he's pointing at.
Okay, regarding his shortness of breath, we can put some oxygen for him. Also, we can take withdraw some fluid from his tummy after taking an opinion from Mr. Mann, or we can also give him some medication to get rid of this fluid in his tummy, as this tummy pushing his lungs and make him suffering from shortness of breath.
okay. Okay, so what do you think you need from me now, doctor?
Should I be
The question-
informing his brother who lives in Australia?
So, doctor,
Yes.
yes.
Yeah. For that, I think after doing the CT scan or another alternative plan, you can tell him about his condition after taking a full picture of his condition, or you can tell him just what we have in our hand, which is a cancer cell from the fluid only. And as his brother is have some heart problem, I advise you to tell him to, if he want to travel to UK, it's better to visit his GP to give him an advice regarding his heart problem and some medication.
Okay, doctor.
Okay, you can close the consultation.
Yeah, yes. Let me summarize what we have discussed before. You came with your husband couples of day with the tummy swelling, and we take fluid sampling from his tummy, and this tummy fluid was show a cancerous cell, and unfortunately we done a CT scan for him. Unfortunately, our CT is broken or not working. For that, we want to do an alternative imaging for his tummy. Also, we want to treat him with the shortness of breath, and we will make an next appointment with Mr. Mann to see you after taking an appointment with him. And if you have any question, I will leave my number with the nurse here. And if you want any question, I am happy to see you again. Thank you.
Thank you.
Okay, thank you, doctor.